Welcome to WACO, and thank you for taking your seats. We are going to start the meeting. WACO is the Water Advisory Committee of Orange County. We usually discuss issues related to water. The main participants are elected officials from the city legislature and the water district. We have a selected number of experts that attend the meetings every month. Today I'd like to start the meeting with the Pledge of Allegiance, and I'm inviting Director Brooke Jones from Yorba Linda Water District to lead us in the pledge.
Please join me in the pledge to our flag. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. I'd like to ask anybody here for the first time, please, can you introduce yourself so we can
my name is Bill Trucksaw. I was invited by Fred Italian here, and I'm a civil engineer. I work for Joseph C. Trucksaw Associates in the city of Orange, and I'm glad to be here.
Thank you. Welcome. Anybody else?
Stand up, Shorty.
There you go. My name is Dennis Calvert, and I'm the president of BioLargo. We're a technology and science company heavily involved in the water business.
Thank you. Next, anybody else? Anybody bought raw water already? Raw water.
They're sold out.
They're sold out. Well, San Francisco is selling a jug of 2 gallons for $64. This is pure natural water taken from the river and park. There is an inspiration of 2 weeks because it will go green. If the coffee tastes good, it is because it wasn't made with raw water. I'd like to invite the Vice Chair of the Election Committee of the WACO group, Director Larry.
Good morning, ladies and gentlemen. As usual, in channeling Wes Bannister, we on the committee took the money from you coffers and cruised the Hebrides for a while, discussed this in great length, asked for nominations, and you just underwhelmed us with it. We looked at the situation carefully and evaluated, as we often do, and discovered that is often the case, that the current officers, the president and the vice president, just really haven't done a very good job. And as a result of that, we think they need another year in order to get it down right. All joking aside, we all know that Jose and Jim have done a crackerjack job. We appreciate their being willing so to do. And in conversation with them and with a very small contribution to their campaigns, I have convinced them to run once again for this prestigious office. So if it's all right with you, I would like to ask for a vote of acclamation to re-elect the president and vice president for 1 more year.
Yeah. So
Thank you. I promise we'll do better this year. In fact, last year, 1 year ago, I had the flu. I was wearing all my garments. Flu season again. I'd like to start then with the reports, and I'd like to invite Kathy Green to give us the report on that.
Good morning, everybody. Since it's the first of the year, this will be a short report. Let's see, I'll give you an update on the requirements for testing of lead in our drinking water at our California schools. WACO will host an informal webinar Tuesday, January 9th from 2 to 4 for public and community water systems that will provide updates on requirements for testing of lead in drinking water for the California schools and for compiling the lead user service line inventories in service distribution areas. The webinar will mostly focus on new requirements under AB 746, which was the Gonzalez-Fletcher 2017 legislation, which sets July 1st of 2019 as a deadline for community water systems to test lead levels in school drinking water. The requirements affect all California public K through 12 schools constructed before January 1st, 2010. The webinar will provide information that water systems can forward to schools within their service area. And I know most of our water districts have been getting calls on this, so this will help you to get them the information. Our state water board staff will also outline reporting requirements under SB 1398, which is Leva's bill, 2016 bill, and also his 2017 bill for community water systems to compile and submit inventories of lead user service lines by July 1st, 2018. Yes, sir?
Kathy, do you know what they were doing before this? Were they doing nothing, or was there?
No, they weren't.
This is all new then?
This is all new. And the confusion lies in, it's the water that they're testing, but it's really mostly the pipes in the schools that are the problems. And so that's what everybody's worried about. So when you get these high lead levels, everybody starts panicking and they go to the water districts. It's really not the water district water, it's mostly the pipes. Yeah. So, and then Tuesday, our Aqua board ratified the committee chairs and vice chairs at our, Tuesday was January 3rd. And so we have a new president, President Brent Hasty of Yuba County. And so if you need any information, get hold of me, get hold of Brent. He's a phone call away, and he actually answers the phone. And then we've talked about this before, but our drinking water tax SB 623 Monning bill, which is of critical importance to all of us. It calls for the first ever drinking water tax. It became a 2-year bill, and so it will be returning this year as a top priority. And the thinking right now is they're going to start trying to push that through right away. So be on the lookout. And Aqua approved spending funds to gear up for the opposition of SB 623. So I hope when you get all those alerts that we send out, that you all will react and get on board and try to give us your support on this. And then the money that we have proposed to spend now is to understand public attitudes around a drinking water tax and a few other activities. It depends on how far that money goes. And so we'll be doing that poll soon to try to react to this. And then last but not least, we have some Aqua scholarships that are now open for application. There are 4 scholarships, 3 for undergraduate students and 1 a graduate scholarship. Please apply before March 1st, and you can just go on the Aqua website and all the information is there. So if you know of students, please have them apply. These are brand new scholarships. So thank you. Any questions?
Thank you, Kathy. Well, our favorite Director Linda Ackerman is not here today, so we invited our second best.
I thought it was me, you want to? Okay, well, they turn on you, don't they? Linda, as you know, always ends her presentations with a factoid. I'm not as bright as Linda, nor are my ankles as nice, you must have put up with me this morning. But I will start off with a little grandfather humor that you can use. You can even use it if you're a grandmother, or if you just have small children you like to talk to. What is Beethoven's favorite fruit?
Banana.
Never share your stories with us. Or if you steal it from Brett, don't let him be in the room with yourself. The Met report comes down to basically what's going on right now is the beginning of the budget cycle. We finally, just a few short years ago, began to be able to move into a two-year budget cycle. I think it's probably one of the most beneficial things we've done as far as the actual day-to-day mechanism of metropolitan supply. With that, you as retail agents will get some guidance on what is anticipated to be the budgetary plan or map for the future for 2 years instead of just one. So we'll be looking into that. The options shall be put before the board, and I would think in late spring of 2018 we'll have those numbers. Included in there will be a 10-year forecast about water sales, the revenues we can expect from that, the expenditures that we'll be employing, and then whatever CIP plans might be in that particular budgetary period. MODOC, as most of you probably know, in this room, on the first Wednesday of each month, has a joint meeting between the members of the board of directors of MODOC and their Met delegation, to which all of the other Orange County Met delegates have been invited, as are each of you and the water board for communities. We'll be talking about that budgetary process for the next few months. Should that be of interest, 8:30, first Wednesday of the month. This past month, at the meeting, Met also adopted legislative principles. Rather robust discussion was held. We had input from a number of people. We won't go into the long, lengthy list. Some are more robust than others. Thank you, Chuck Gibson. We have the comprehensive assessment of Lake Matthews and Lake Skinner is being funded. We have some concerns about that, which need to be looked at. But it's not really a concern more than it is performance. We have some funding being set forth for upgrading the monitoring systems in both of those lakes, installation of slide gates on the Colorado River Aqueduct, the spillway gate in Eagle Mountain. Deemer, the one closest to our heart because it's right here in Orange County. We're adding another $6 million to the fund there on the seismic approaches and repairs and preemptive development. Beyond that, thank you for the opportunity to make this report. I forgot to mention the concrete to the PCCP. We have about 100 miles of PCCP that we've looked at, the 5 major runs that over the next several years, or next 10 to 15 years, we'll be working on. That's going to be north of a $500 million project, but the ANP is one of the areas we're going to be looking at down here. Wanted to reassure you that everything's going to be all right, and we're going to get a steel liner to throw in there. This is a liner that is qualified to be standalone. We'll be using it for lining that big pipe. It is sort of the life's blood, if you will, for a number of our agencies. Ladies and gentlemen, thank you for the opportunity to give you the Met report. Tell Linda that we miss her.
Well, a few weeks ago, we heard the news about some hepatitis epidemic going on in San Diego, and somehow related to water. So that brought the concern of many of you to our meetings, and we decided to investigate if there was a real threat to that. We don't know yet, so that's the reason we invited the experts today. And today we have 2 experts that come from San Diego, have been fighting this case, investigating it, and addressing it. The first speaker today is going to be Dr. Eric McDonald. He is the medical director of Epidemiology and Immunization Services in the County of San Diego Human Health Agency. Dr. McDonald served as a medical director of the San Diego County's Immunization Services branch, where he oversees a region effort to monitor, treat, and prevent infectious disease. Before joining the county, Dr. McDonald served 24 years in active duty in the U.S. Navy, including 2 combat tours to Iraq. He was formerly the first Marine Expeditionary Force surgeon at Camp Pendleton. He practiced from 2005 to 2010. He practiced medicine at the Naval Medical Center in San Diego. He earned his medical doctorate at the Uniformed Services University of the Health Sciences at Bethesda, Maryland, and a master's degree in public health from the San Diego State University. Please help me welcome Dr. Eric McDonald.
Thank you very much. Maybe somebody could cue up my talk on here. I don't know the best way to do this since I'm not used to this system here. Thanks for inviting me today to talk about our experience with hepatitis A in San Diego. I can see the way the meeting began, this could be a tough crowd, so I'm going to go with it. I'm going to take the risk and say that actually at any time during the talk, if you have any questions, please let me know, because I have sort of a set of things to talk about, but depending on the audience, we can dive deeper into certain areas that you want to talk more about. I think you may want to talk more about issues related to water, and I anticipated that, but I don't know exactly the kinds of questions that you might want to ask, so I'll leave that opportunity open when it comes. First, just what is hepatitis? Hepatitis is an inflammation of the liver. It can be caused by a lot of different things. It can be caused by chemicals like alcohol, it can be caused by infections, toxins, or certain medical conditions. It can be temporary or long-term, and we usually use about 6 months to do the dividing line between what is acute and chronic hepatitis. But we're talking specifically about viral hepatitis. There are actually a lot of different viruses that can cause hepatitis. The most common ones have lettered names, and I put them up here for your identification. Actually, I think they go all the way down to hepatitis G now in terms of the letters. But hepatitis A, B, and C are the most common, and probably the most important for you to know about in this room, because the first two, A and B, can be prevented by a vaccine, and C can be screened for and treated with medication. So it's very important that people are aware of those. But the outbreak I'm going to be talking about is hepatitis A. And before I talk about that, I just wanted to mention that the symptoms of hepatitis tend to be fairly similar across the board for viral hepatitis. Usually you get symptoms. You're going to get a sort of a mild flu-like illness with some nausea, vomiting, diarrhea, fatigue, fever, muscle aches, followed by a triad of classic symptoms of Coca-Cola colored urine, light colored bowel movements, and your eyes and skin turning yellow. And I think most people in the community know that when you turn yellow, that's something to do with your liver, and it's probably hepatitis. Unfortunately, people don't know much more than that sometimes, and will lump all kinds of hepatitis or illnesses of the liver together, and sometimes can confuse things about them. That's a problem from the public health perspective in terms of messaging. So hepatitis A is one of the viruses that can cause hepatitis. It is fairly contagious. It can be spread easily from person to person. It can last, it can cause an illness that can last from weeks to months, and it can sometimes cause death. It has an incubation period, that is the time you're exposed at the time you come down with symptoms, that is relatively long. It's on the average about 40 weeks, but it can be anywhere from 2 to 7 weeks. And that's very challenging from a public health perspective, because if it takes that long for something to develop,
And it's due to an exposure, either to another person, or to a food item, or to water, trying to get histories of people of what they did for 7 weeks ago. I don't remember what I did yesterday half the time. So trying to get really good histories that far back can be really quite challenging. Another problem with this is that this is a virus that can live outside the body for long periods of time, actually depending on the environmental conditions. So it can contaminate surfaces, and then if that surface is touched and then you ingest, it can actually cause an infection. Yeah, question already.
When
That's
is
good.
the vaccine effective?
What's that?
How long is the
Oh,
vaccine?
I'm gonna get to that.
Vaccine.
I'm gonna get to that. I'll talk about vaccines here a little bit later. So, but feel free to keep interrupting. Because, I might not have it later in the talk. The virus can, like I said, live outside the body for long periods of time, but it is actually degraded by environmental conditions that are relatively routine, which is to say that ultraviolet light from the sun will actually degrade the virus within just a few days. And so we make the point it can last for long periods of time, but we don't want to overemphasize that to make people think that it is a persistent contaminant, in the general environment for a long period of time. It can be killed by heating by at least 1 minute above 185 degrees. Actually, if you freeze it, it doesn't mind, okay? It actually likes to be cold. And one of the more famous outbreaks recently in the United States was from frozen berries that were contaminated by pomegranate arils that were imported from Turkey. And, those could be sitting in someone's freezer for 6 months, and if you then broke it out and made a smoothie out of that berry mix, you could come down with hepatitis A because the virus was still viable. Adequate chlorination of water actually will kill virus, so that's why we really don't have an issue with that in this country. If you have a good sanitation system in which adequate chlorination is being performed, water is not really going to be a major source of distribution in the population. But if you look up in any website about hepatitis A and how it can be spread, it's going to prominently feature can be spread by water, because in places where there aren't well-developed sanitation systems and water distribution system, that is an issue. The vaccination is the best tool that we have to prevent hepatitis A. A 2-dose series is extremely effective in essentially providing lifelong immunity after the 2 doses. Now, the vaccine's only been around for 25 years, so we can say for sure that it's good for 25 years, but it's presumed to give lifelong protection. So I'm going to start here.
Yes,
Question?
yeah. So if it's protected from UV light, then how long does the virus survive?
It could be months. It could be months. And the question was, if it's protected from UV light, if it was in your refrigerator, for example, if you stuck it in there for a year and then brought it out, it would be perfectly viable.
But under the
In the environment, if it was protected, it could be months as long as it's not being overheated. Yeah. In the back.
Yeah, so what kind of authority does health regulators have for these new things like raw water, where you're not chlorinating, there's no chlorination?
But you're asking a question about health oversight of unchlorinated water?
Yes.
Actually, I don't know the answer to that specific question because I don't really spend much of my time in sort of the regulatory realm. But I'll hold that and get back to you if I can. Maybe there's somebody else in the room that might actually know that answer better than I do. Yeah, question.
It all falls under treatment regulations for log removal and all that, so it's, I guess, treat raw water.
They're what?
When you treat raw water, it's.
No, there's a new interest in, and in San Francisco, people are paying $60 for 2.5 gallons of what they call raw water. It's untreated stream water, unfiltered, untreated, and you can buy it in stores.
Well, I'll tell you that the good news is that in terms of specifically hepatitis A, I won't go there for other things that could be in water, but specifically for hepatitis A, the only organism that perpetuates hepatitis A in the environment are humans. Okay, so if there isn't human feces that's going to potentially enter the production stream, shall we say, of this raw water, then and humans who actually have high levels of hepatitis A in the community, then that's not going to be an issue. But I'm going to leave aside the whole other issue of what can be in raw water. So
Yeah, in terms of regulation too, Eric's like, we do epidemiology, we don't necessarily do the environmental health side of public health, so neither of us are real experts on it. I think that in general, for us, our response in such situations is when people actually get sick. So that's kind of when public health comes into the game as opposed to, simple ongoing regulatory responsibility. So there's a reason we don't have a huge amount because we don't usually enter.
Well, why I ask the question is because it's a concern that if there is an outbreak because of hepatitis from people drinking what they call raw water, and it traces back to water, our client or our customers are going to get confused as to whether their water is safe. It's going to be an issue, a public health issue.
If there's indication of people becoming sick from a source, at that point, the local health officer has very broad authority to respond to that, to protect the public health. So if there is an issue, then yes, we can respond. But prior to that,
Okay, thank you.
yeah. Well, I'll move on, but that's an area we can dive deep into in terms of what we do when we have an outbreak and how we investigate it. So who's at risk for hepatitis A? So people who travel to countries with high rates of hepatitis A, actually Asia, Africa, some parts of South America now would be higher endemicity countries or countries with high levels of hepatitis A normally in the environment. The United States is a very low endemicity country, meaning it has a very low rate, but we do have hepatitis A that is actually present all the time to some very small degree here in the United States. Men who have sex with men, injection and non-injection drug users, people who have certain clotting factor disorders because they're getting a lot of blood transfusions, they're all at high risk. Actually, people who have chronic liver disease aren't at higher risk for getting hepatitis, but if they get hepatitis, they have much worse outcomes. People who are in unstable living situations, unsanitary situations such as homeless, which is the core of this outbreak that we have now, people who are living with people with hepatitis A or adopt children from overseas where there are high rates of hepatitis A. And this last bullet here, people who have ongoing and frequent contact with individuals who are at high risk are added to this list because that's what we've had in San Diego. And I'll talk a little bit more about that in a moment. So what happened in San Diego? Well, in March of this year, we noted that the number of hepatitis A cases that were reported to the Public Health Department from the end of November through February was about 2.5 times what we would normally expect to see in terms of the monthly reports coming in to us in the health department. We were also seeing that the types of people who were being reported with hepatitis A were different than what we'd seen previously. Normally in San Diego, the vast majority of people with hepatitis A are international travelers. But what we noted was that the people had shifted, and this group that was now a higher number were primarily homeless individuals and individuals who had illicit drug use. And interestingly, we weren't able to interview those folks because by the time we heard about those cases, those people had been released from the hospital and we could not track them down to interview them to find out what kind of risk factors that they had. So we detected that increased level in early March, and actually in the first week of March released our first health alert to the community saying, hey, we've picked this up. It looks like there's an increased rate in this group, and hey, providers, if you have somebody who is either homeless or an illicit drug user who looks like they have hepatitis, please tell us right away while they're in your office so that we can interview them and start the process of gathering what it is about them that's causing this outbreak. And we actually got a good response with that, and over the next number of months, certainly learned that we had a significant outbreak, first occurring in the eastern part of our county and then occurring in the central part of the city of San Diego. With thorough histories of all those individuals going back 7 weeks, asking about their drug use, about their contacts, about what they ate, where they ate, what they were drinking, what they were exposed to, we could not find any specific common source for any of these individuals, and to date we have not found a common source. Now, that's important to note because in the public's mind, hepatitis A outbreaks in the United States are caused by common sources. They're caused by food or water specifically. But that's because that's what they hear about when they hear about hepatitis A outbreaks in the news. But it turns out the most common transmission in the United States for hepatitis A is person to person. And that is exactly what was going on in this outbreak, was it was being transmitted person to person or by the equally contaminated environment in which these individuals were living, which was quite unsanitary. This is a graph of what has been happening in San Diego over the years. On the left part of the graph is the mid-90s, and back then, before we had the vaccine, we'd have between 400 and 600 cases of hepatitis A in San Diego per year. Turns out that was one of the highest rates in the country. Actually, California and the southeastern parts of the United States had the highest rates in the United States of hepatitis A. Most of those cases were children, and most of those cases were either very mildly symptomatic, and very few of those cases died. When the vaccine was introduced, first here in California and then across the country, there was a precipitous decline in hepatitis A. So that really, in the 2000s, in San Diego, we only had between 2 and 3 dozen cases a year, and almost all of them were travelers. And of course, now we've had over 600 cases reported in San Diego due to this outbreak. This is a little bit of a hard graph to see, but what it's trying to show is back in the 90s, the high rates that were seen of hepatitis A, the red line at the top, are children under the age of 14, were kids, okay? And when the vaccine was introduced to the kids, not only did it help the kids, but it helped the entire community in terms of hepatitis A rates. Very low rates, and then in 2017, the numbers shoot back up, but there's 2 lines that overlap. It's people between the ages of 25 and 65 that are being primarily affected. And the rates are higher than they ever were back before the vaccine was developed. I put 2 little blue dots on there to show what the overall rate for the population is. And the overall rate for the population in San Diego is still lower than it was in the 90s, but it's a different group who are affected. And that's the key point of this slide. So here are the stats as of this week. 577 cases that are related to this outbreak. Almost 70% of them have been hospitalized. We've had 20 deaths. There's a male predominance, which actually reflects the male predominance of the individuals who are actually on the streets in San Diego, who are homeless and illicit drug users. The age range is from 5 to 87. We've only had 2 pediatric cases, that is under the age of 18, and both of those were unimmunized children from vaccine-refusing families. The suspected exposure types are listed there. 33% of them were homeless and illicit drug users. 16% were homeless only. 13% were illicit drug users only. 30% were neither homeless nor illicit drug users. But the majority of those individuals were people who had connections to those first 2 groups, such as volunteers who worked at homeless shelters, physicians and nurses who take care of homeless individuals, people who live in the same house as somebody with hepatitis A. I like to use the phrase that if you share a bedroom, a bathroom, or a kitchen with somebody with hepatitis A, that makes you a close contact. And that actually constitutes most of the people who are in that neither group who don't fall into one of the first 2 groups. And then we have about 10% we don't know because we couldn't track them down to interview them to find out all of their risk factors, and it wasn't in their medical records. About a quarter of the people had either hepatitis B or C or both, and that's important because it goes back to the fact that people who have chronic liver disease, these are people who should have already been immunized but actually weren't, and that's one of the reasons why we have worse outcomes, is because so many of them had other liver conditions at the same time. We've also had 40 cases of hepatitis A in San Diego that aren't part of the outbreak. That is to say that there were people who were travelers who had hepatitis A, and that's a little bit higher than our normal baseline, but it's because our doctors, because of this outbreak, are getting so good at diagnosing and treating and reporting hepatitis A that they're probably picking up cases that we didn't pick up before that were always occurring. So that's why our total is now over 600 cases for the year. We only have a couple of cases under investigation, and sadly, we in San Diego have been exporting our cases to other places. There have been other counties who've had cases from San Diego, including Orange County and Los Angeles. And actually, small outbreaks have occurred in other states that started with somebody who was exposed and went to another, in San Diego, went to another place and caused illness. Specifically, about 24 cases in Arizona. They now have 124 cases in Salt Lake City, Utah. They're up to, I think, 42 cases in Louisville, Kentucky, and they have, I think, 5 cases that are related to our outbreak in Denver, and 1 case in Rhode Island. Here is the epidemic. I'm sorry, question.
Have they correlated the outlawing of the single-use bags?
Ooh, I'm going to talk about that. A question about bags, so I'm going to talk about that in a second. Okay, great question. So here's the curve. This is on one end of the curve is October 30th, 2016, and then this week is the very last week on the end. That each bar represents 1 week. And I put an arrow on the first week of March, which shows when the outbreak was identified. And it was really in September 1st is when we declared a public health emergency in San Diego, and that's the second arrow that I put on there. And you can see we had a fairly substantial number, an increase of cases. Once the emergency was declared, we were delivering vaccines by the tens of thousands in San Diego, and there was a precipitous decline in cases that was actually faster than one would expect based on just immunizations. This is also when the city of San Diego and the city of El Cajon started doing some street cleaning activities that I think significantly contributed to the outbreak control, and I'll talk a little bit more about that in a moment. This is a map of San Diego by zip code, which shows the cases. The darker the color, so the darkest blue there is the highest number of cases, and those areas correspond to central or downtown San Diego, and then the area in San Diego of La Mesa, Santee, and El Cajon, which are where the great majority of cases occurred. In response to this outbreak, since March through last week, we collectively on the county and the community stakeholders have provided 115,000 vaccines to adults, most of whom were people at risk, one of those groups that I talked about, either homeless or illicit drug users or men who have sex with men. We've actually conducted over 2,000 vaccine events in San Diego and done over 24,000 vaccines in the field, and I'll just again describe that in just a moment. I want to quickly say that we're not the only ones that have bad outbreak. There's actually a really bad outbreak going on in Detroit right now. They currently have the silver. We have been bumped down to the bronze medal, okay, in terms of the worst outbreak since the vaccine was developed. By the way, the gold goes to Pennsylvania because they had an outbreak of almost 700 cases due to contamination of green onions in a restaurant chain back there. So we have been surpassed just in the last month by Detroit. Their outbreak has actually gone on 4 months longer than ours. It's in the exact same population though, homeless and illicit drug users, and it's the same dynamics of just unsanitary conditions that are driving the outbreak. They have a few more men who have sex with men in their outbreak, and that's been a contributing factor in the last couple of months. And I'll show you their epidemic curve. You can see that theirs is bad. Theirs is still going on. They're still getting 15 to 20 cases a week, actually still, and it's pretty significant. And then they're actually doing some of the things now that we did back in September to try to get their outbreak under control. Yeah?
Quick one. Is there a herd immunity thing with these outbreaks? I mean, if you've been vaccinated, there's herd immunity of the people around them. Does that work with this?
Yes, he's asking a question about herd immunity, meaning if there are enough people in the community who are immune to the disease, will that stop the propagation of an outbreak? And the answer is absolutely yes. The good news is for hepatitis A, that herd immunity needs to only be around 60 to 70% in order to stop the propagation of an outbreak. That's much lower than something like measles, where you have to have greater than 90% of the individuals to stop an outbreak. So that's a great question, and yes, we think that with our vaccine efforts, we have actually hit our target of where we want to be, and that's why we think that our numbers have gone down so significantly. So this was the public health strategy to control the outbreak, three-pronged: vaccination, sanitation and hygiene, and education. And I'll talk a little bit about each one of these three. And I think you're going to be most interested in number 2 for this group. But I'm a public health guy, so I'm going to talk about the thing that I know the best, which is number 1, the vaccination. And again, as I mentioned, the 2-dose series is highly effective in protecting people against hepatitis A. This is not a new strain. This is just a strain that's not usually seen in North America, but is controlled by this vaccine. Just 1 dose actually is about 95% effective, and that 2nd dose gets you to 99.7% effective, presumably for your lifetime. And again, I put here 25 years because that's what the CDC says, but yeah.
Given the population that's at risk, how successful are you in getting that 2nd vaccination?
That's a great question. I mean, we had some difficulties even getting that 1st dose into people because they were hard to reach, not people that would come in for medical care. And we are just literally now, if you do the math, we really started doing mass vaccines in April and then really took off with vaccines in September. So a lot of the people who are due for their 2nd dose are really coming up due now through March. And we are actually going out and doing the same kinds of things to do outreach. I have lots of stories of people who were given their cards 6 months ago, even though they're homeless, they still have their card, they were coming in and turning it in for shot number 2. And I'll tell you, this is a community that gets most of this information by word of mouth, and most of these people know somebody who either was hospitalized or died from hepatitis A. So and from their perspective, they know it's important. They've held on to that, and they're actually coming in when we have these field events and showing us their card and getting their 2nd shot. Question?
How would I find out if I had a vaccination?
Well, hopefully you kept records. If you haven't, you have your records that have been entered into some sort of database. We have immunization registries in San Diego and across California, but unfortunately, they're very strong for pediatric immunizations, not so strong necessarily for adults. Most adults, people our age, frankly, unless you travel overseas or you were in one of those known risk groups, you probably weren't vaccinated. The military didn't start vaccinating people routinely until the late 90s, and really, in terms of veterans, we don't consider you to be immunized unless you were on active duty after 1999. Question? Yeah. Or answer.
Yeah, I was going to comment there, and maybe since you've dealt with this a lot more, an awful lot of people who are adults say, yeah, I've gotten a hepatitis vaccine. An awful lot of times it's Hep B, right? It's the hepatitis B vaccine, which does nothing for hepatitis A.
Yeah, he makes a great point. Most people just think hepatitis is hepatitis. It goes back to that thing I said at the very beginning. They don't differentiate between the viruses, don't get that there's an A, a B, a C, a D, and that sort of thing. And the hepatitis B vaccine came out in the 80s. And so it was much more widely pushed, and has been a routine vaccine for a number of years. And so many people think that, oh, I had my hepatitis shot, but they really got it back in the 80s or early 90s, and it was the B and not the A. And so I say, really, unless you people in this room, frankly, unless you travel overseas or were on active duty like I was, because I got my hepatitis shots when I was on active duty, you probably aren't immune. And that's why, again, in this outbreak, what we're seeing is the average age is 44, and we have, again, people going through the age groups of everybody in this room, frankly. The good news, though, is that the people in this room are not really at risk. The general public is not really at risk of hepatitis A unless they're in one of those groups that I just described. Actually, this is great because it leads into who should be getting the shot. The good news is, I'll answer the question in just a second. All children are getting the vaccine, or are recommended to get the vaccine. People who travel to specific countries, men who have sex with men, drug users, chronic liver disease patients, people who work with primates and close contacts of international adoptees. Yeah, question.
Well, you're almost answering it. Yeah. I'm involved in setting up an activity in El Cajon in about 3 months. Should we be concerned that we're bringing women from all over California, and are they going to be at risk?
What's the activity?
So they're going to be a golf resort.
Oh, no. The general public is not at risk for hepatitis A. I mean, again, and we've said that to the people who are residents in San Diego and people who are visiting San Diego who doing what I would say is, routine activities in the county of San Diego. They're not at high risk for hepatitis A. Certainly, if you're traveling to Baja California Sur or you're going to Asia, that's a reason to get hepatitis A shots. But simply coming and doing what I would say is routine business or tourism to San Diego, there's no increased risk for hepatitis A. Especially we've got the outbreak pretty much under control. Yeah. So what we did locally is I gave you the CDC recommendations on the previous slide. These are the recommendations we made locally to our through our public health officer. First, as soon as the outbreak was recognized, we recommended vaccinating homeless individuals, which, by the way, is not a national recommendation. And then in a couple months later, we had some cases occurring in people who work with the homeless, so we recommended that anybody who works on a close and ongoing basis with the homeless, either through an agency or through volunteerism, get vaccinated. We also recommended the same to all of our public safety workers and our EMS providers and behavioral health. And then we also recommended to specific healthcare workers in hospitals where they were seeing these patients, specifically the emergency departments that were seeing the high numbers of cases, because we have had 7 healthcare workers in San Diego who are part of this outbreak, all of whom were individuals who are working closely with this population. We expanded it in June to sanitation and janitor services workers, people who work with in cleaning restrooms on a routine basis and that sort of thing. We did have a couple cases in that group. Also people who were street cleaners, such as urban Job Corps folks, going out and doing cleanup after the homeless. We recommended that they get vaccinated. And then in August, we recommended as a precaution, not because they were at increased risk, but we wanted to be sure that we were protecting the general public. All of our food handlers in San Diego were recommended to get hepatitis A vaccine. Again, it's worth noting that anybody who goes in now to their physician and says, I think I'm at high risk for hepatitis A, I would like to get the shot, that is actually an indication to give them the shot. Because some of the indications that were on that list, like being a drug user or a man who has sex with men, those are sometimes not necessarily comfortable things to disclose to a provider or to a pharmacist when you want to get a shot. And the CDC and the American College of, or the American Advisory Committee of Immunization Practice wanted to make sure there were no barriers to individuals going in and getting a vaccine if they in fact were in one of those groups. So that's why it should be available on demand when somebody self-identifies as a person at risk without explaining what that risk is. So we did a lot of things in San Diego to get vaccines out to folks. We did mass vax events at specific homeless service providers. We had providers of the homeless being given free vaccine, purchased both by the county and supplied through the state and federal vaccine programs. We gave vaccines at needle exchange programs and at substance abuse treatment centers. We started immunizing every person coming into the jail system in San Diego, because a very high percentage of people who go to jail are homeless and illicit drug users. And so we were able to not only protect the environment of the jail by giving them shots when they came in, but also getting that target of opportunities that came through and touched our system, so to speak, to get that shot before they went back out into the street. And the last thing that we did was we created these foot teams in which we paired a homeless outreach worker or a law enforcement person with a public health nurse going out onto the streets and into the canyons where these individuals live to give them the shots, because we knew that they wouldn't present otherwise. And so this is an example of one of our first mass vax events at one of our major downtown homeless shelters in San Diego, St. Vincent Falls. I was actually at this event, and it's memorable for me because when we had about 150 people lined up for shots, 2 of the individuals who were lined up for shots were yellow already, and I just pulled them out of line and said, well, you already had hepatitis, you need to go see a doctor. Okay, and actually what that shows you is that there was a burden in the community of people with illness that weren't even going in and propagating the epidemic in the field. And actually, in the first few events like that, we almost always pulled somebody out who actually had hepatitis and actually just sent them in for care. This is an example of one of our outreach teams. We set up a mobile van, and these folks would go out and promise to stay with the stuff Because one of the reasons people don't want to come in to get their shots is because if they go in and get a shot, then the stuff that they're leaving out on the street gets stolen. So these folks would stay with their stuff or help them carry their stuff in to where they could get a shot, and then they could come back out and get planted back out in the field. And this is one of our homeless outreach teams of a nurse and a worker going out and just giving shots actually out in the field. Yeah. Oh, I'm sorry, question. Yes, I'm sorry.
You said you found 2 people that were yellow already, so how fast does the vaccination attack?
That's a great question. How fast does the vaccine work? It turns out the vaccine is so good that it can be used as prevention. That is, if you're exposed to hepatitis A and haven't had your symptoms develop yet, if you can get it quickly after exposure, within 2 weeks actually, just getting the shot will prevent you from getting the disease. So your immune system will get up to snuff in about 2 weeks, but it's actually, again, so good that it can actually prevent even after exposure. Yeah.
With your proximity to the border and probably less stringent regulations in the Tijuana area, are you reaching out in all of the people that come across the border on a daily basis? What are you doing with that?
It's a great question. You know, one of the first questions is, hey, San Diego's a border county, and did this come from Mexico? But I can sort of answer it in 2 ways. The endemic strains of hepatitis A in Mexico are called 1A strains, and the strain that's causing our outbreak is a 1B strain. We are in close contact with our colleagues in Baja California, and the total number of cases that they've had in the entire state of Baja California so far this year, 37. So they are actually kind of worried about us. I mean, we've already exported it to other places in the United States, so that's an issue. So I can sort of really pretty definitively say that's probably not where it came from. Yeah.
So in the United States now, every kid has hepatitis A vaccination, so that's why virtually no kids have gotten sick.
Right.
What is it in Mexico? What is it? Do they provide hepatitis A?
They don't actually do routine immunizations in Mexico, but actually the reason that the rates in Mexico have fallen precipitously in the last 20 years is because of sanitation issues. I mean, they have just better water systems, better trash systems, and actually, again, their curve kind of has followed ours by maybe a few years distant. They may have benefited from a lot of vaccinations here. In the border region, as you well know, a lot of children will come across the border and get vaccinated in the United States and they go back over if it's not a vaccine that's already covered by the Mexican vaccination programs. Their vaccination rates actually tend to be better than ours for the ones that they have the program, but in place, such as measles and mumps and rubella, but hepatitis A is not one of their routine vaccines. So on the sanitize and hygiene, and I know this is maybe more just the folks in the room, you know, one of the first things we developed was something called a hygiene kit, where we gave individuals kits that had hand sanitizer and wipes and soap and plastic bags, and just it was an opportunity for us to talk to them about what hepatitis A was and that sort of thing. Hand sanitizer is not the best tool to use against hepatitis A because it's a virus that is actually relatively resistant to alcohol that's in those hand sanitizers. You really have to use effective hand washing, but we need to tell people about that. And we did give them plastic bags because if you know the culture of people who live on the streets, one of the things they do is they like plastic bags to be able to poop into them basically, and then tie that off and then throw it away. And there is some thought that perhaps the less availability of those bags may have made just open street defecation more likely, and that might have contributed. We don't really know that. I mean, again, one of the questions that we asked ourselves in San Diego was why us? Why did this happen in San Diego? Because there are other places with lots of homeless people. And some of those other places have had plastic bag bans before we did, and they didn't have outbreaks. So I'm not really sure if that's the cause, but it could have contributed. You know, one could make an argument about that in a sort of behavioral way, and we tried to address that from the public health perspective by giving those bags out to these individuals so that we could at least solve that issue. But also, we increased access to public restrooms. That was actually probably the better approach. And then putting porta potties and hand washing facilities out for these individuals. That was a better response than just giving them more bags. Question?
On a previous slide, you had the business of chlorination.
Yeah.
That's been around, what, the 20s. How about the rest of the systems that are being used, like ozone, the effectivity, ozone in our water supplies, does that work just as well? Ultraviolet light, you know?
Yeah, the specific tools that are being used to inactivate this virus compared to the other pathogens that can be in the water systems, I'm not an expert on that. I just really don't know. Whether I make the assumption that each decontamination system is equivalent and they're being measured against certain standards for bacteria and viruses in order to meet the standards that you have for drinking and for other water uses, but I'm not an expert in that. So you're asking a very specific question. Again, somebody else in the room might be able to better answer. Yes?
On these hand washing areas that you're providing,
I'm sorry.
are you using warm water or is cold water?
The temperature of the water doesn't matter. Actually, it's the timing of the water that matters. You need to be washing your hands with running water and soap for 20 seconds, which, by the way, is a lot longer than people think. And what I tell people, like on this slide, is to sing happy birthday to yourself twice. That is actually about the same amount of time. Don't do it out loud because people will think you're weird. Okay? But that's a long time. And in fact, it's so long that I like to tell doctor audiences that, do you know how long it takes for a doctor to interrupt a patient when they're giving a history, when they ask them what did you come to the doctor for? It's about 5 to 6 seconds before I, as a doctor, interrupt you as you're telling me your story. So trying to get doctors to wash their hand for 20 seconds, that's almost impossible. Because they just start that patient. But just think about it. Next time, actually today, do this exercise. Sing happy birthday to yourself when you're washing your hands, and you're going to go, I never wash my hands this long. Okay, all right, but you got to. Okay, that's the real reason that you got to be doing that. And question in the back.
Well, that leads to the question. There's a lot of automated faucets that have been installed everywhere, and the plumbing code requires that those turn off after 15 seconds.
Yeah.
So we have a recommendation that's contrary to the plumbing code. So how do we make an emergency change to the plumbing code?
Well, the good news, there are only very specific viruses that don't respond to less hand washing and hand sanitizer. Unfortunately, hepatitis A is one of them. Norovirus is another. Okay, but you're right. Actually, in the building that I work in, it irritates the you-know-what out of me that I have to sort of sit there and reactivate the thing in order to do my 20 seconds. So I'm running out of time. I want to give Dr. Zahn to have a chance or two to jump in here if possible. But the other two things I wanted to mention were here's our hand washing station. Here is a slide showing the street cleaning that's going on in San Diego. Street cleaning has been going on in San Diego for years. Okay, so it's not new. Okay, but what is new is that we took some of the techniques that they've developed in Los Angeles, which use chlorine-based cleaners to clean the streets, which are more effective against this virus, to actually do the procedures, and also did it in a more regularized fashion than they had before. That was the change that was happening in San Diego that I think made a big difference. And here's a picture of the San Diego River, and then one of the things that was done in conjunction with this outbreak was to make a concerted effort to clean up along the San Diego River. The individuals who are doing the cleaning, yes, we recommend hepatitis A vaccine for them, okay, and getting rid of tons and tons of stuff out of that area was an important component. And one of the things that I know is in the news and that may be on your minds was there a contribution of either the San Diego River or the Tijuana River as a potential source or propagator for our outbreak? And there's no evidence that that is the case. And in fact, in the United States, there has never been a hepatitis A outbreak that has been associated with a moving water source. Okay, the only water-based hepatitis A outbreaks in the United States have been associated with wells that often had cross-contamination with sewer areas that leaked in to those well sources. And there are a couple specific anecdotes of swimming pools that had suboptimal chlorine in them that were contaminated and led to outbreaks. But there's never been an outbreak associated with a moving water source. Okay, that's an important point to pass on. And And on education, we can just talk about, actually, the things I've already pointed out here is the way you can prevent the illness is by getting vaccine and doing some just common sense thing, not sharing food, drink, or smoking materials with individuals who you don't know, okay? Because you can not just get hepatitis A, but other things can include your flu, which is a big point here. We give these teaching points to people in the field about what to do. Again, this is important for people who are homeless, okay, but not necessarily for the folks that are in this room. And I'll just leave it at that. So I guess I'm going to be given the axe. Yeah. Yes.
Can we spread this by breathing?
No, it's not a respiratory pathogen. Again, measles can do that. The flu can do that. But hepatitis A, it's close personal contact with somebody who's infectious or a contaminated, fecally contaminated surface or food or water product. Sorry.
Thank you, Dr. McDonald. You are relieving us from a concern we had about the water. So people commented that the virus
You're good. I didn't even know.
in any case,
I'm just concerned about the guys.
we have invited the wonderful Dr. McDonald in Orange County. It's Dr. Matthew Zahn. He is the same position but in the county of Orange. Dr. Zahn graduated in medicine at the San Luis University School of Medicine. He served as a medical director of the Louisville Metro Department of Public Health and Wellness, and is currently the medical director of the Division of Epidemiology and Assessment of the Orange County Health Care Agency. He's going to help us with the version of Orange County.
Thank you all. Thank you for giving me the chance to talk to you. So, I guess one comment I'd have to start with is, I hope Dr. McDonald has kind of talked through some of the issues and give you guys kind of a sense. I think that our risk to our water supply in this situation is very, very low. The other comment, though, I would have is that, like, I've been here 6 years, and this is the first time I've been to talk to you all, and I'm really glad to have the chance to do it, because I do think that there are other issues that, not just hepatitis A questions, but other real significant concerns and issues that it seems like I should have a communication with this group about. And so, Dr. McDonald is a saint, because realize if you do the math, like, the meeting started at 7:30 and he don't live here. He's in San Diego, so he drove all the way up. I just drove like 15 minutes. That's about my limit for 7:30 meetings. So thank you, Dr. McDonald. And the other point I just make too is that, like, there are other parts of the world where hepatitis A is endemic. But in the United States, I think Dr. McDonald knows more about hepatitis A now than they said. He's like in the top 10 in the country. So he's really superb. So I thank Eric very much for coming. And I thank you all for having the chance to talk about hepatitis A. So I'm just going to talk briefly about some of our response here and what's happened. So so how has Orange County been affected by what's been going on in San Diego? Because of course we're connected, right? And theoretically there's a border, but that doesn't really mean anything. You just drive across. So as Eric said, there are 500 hundreds and hundreds of cases. What's happened in Orange County? Well, since May of this year, we've had 11 people who've gotten hepatitis A, and we don't know where they got it. Don't have a risk factor. They just kind of sprung out of the ground. And that's really, really odd for hepatitis A. In Orange County, we'll have about 25 cases a year-ish of hepatitis A. So it's not like we never see this. Year to year to year, about 25 cases for a county of 3 million. Virtually all those cases, though, are people who travel to other parts of the world. They come back from an area where the virus is endemic, and then they get sick when they're here, but we know they got it there. So even 11, small number, but it's weird. Do I know where they all came from? I can't prove where they all came from. I think they're all related to the hepatitis A outbreak going on in San Diego, because otherwise we just see nothing. I think that's the case, but I can't prove that. But I would point out, and then we've had a grand total of 2. It's embarrassing to have had 2, and Dr. McDonald's had 500. We've had 2 people who we really are pretty sure are related. One is a person who's homeless, lived in San Diego, was homeless in San Diego, traveled here, and then developed illness. He was instructive to us in one real important way, in the sense that I think for all of us, we think of homeless populations and viruses being passed around as you live in a shelter, or you live in, we call them encampments, right? You know, in a large, you know, an area where there are a large number of homeless people. This gentleman lived in his car. Worse than I started. Okay. He lived in his car. Didn't hang around with other people. So how do you get sick? Well, the way, you know, how do you acquire the virus? He didn't go to shelters. He didn't go to groups. He didn't go to. But every day you have to use the bathroom, right? And he used public bathrooms, and he probably used public bathrooms that other homeless people used. And so that was, you know, and it was the safe way. The local, you know, the local restaurant bathroom that you use. So that's probably a source in his situation. It's probably an ongoing source and risk. The other person is a gentleman in the 70s. Certainly wasn't homeless. Certainly didn't have any risk factors at all. We just did genetic testing of his virus, and we were able to identify that genetically it matches perfectly with what's going on in San Diego. So we don't know exactly how he acquired it. Probably somebody was part of the outbreak, associated with the outbreak, somehow exposed him. We're not totally sure. Okay. So a couple of cases. Now, those two bothered me. You know, when you go from none to some. You know, the 11 cases overall bothered me. But I'd also say, from the hundreds and hundreds of cases that we saw in San Diego, the fact that we've been, you know, you can be kind of positive about this, the number of cases that we've seen here has been pretty dang minimal, testifies actually to the safety of the sanitation practices and all others, that you didn't see a larger, you know, generalized outbreak happening, that it really didn't stay entirely in the homeless population in San Diego. There have been other, you know, communities, you know, or people associated with that population who got sick, but it was very, very, very low. And so, in a sense, I think, you know, to be honest, I find that kind of reassuring, you know, overall. We recommend that persons who are homeless, as like in San Diego, like the state health departments recommended for all around the state, if you're homeless, then you should get vaccinated. We've sent out provider advisories. You know, one thing that we really, you know, noted though is, you know, as Eric has mentioned, it's really not spread to the countryside, so to speak. Even in San Diego, this is not a large risk for the general population. We emphatically do not recommend that the average person, they're not recommended in San Diego, certainly we're recommended here, the average person needs to get vaccinated for hepatitis A because of this issue. It's a great vaccine. If you want to get the vaccine, as Eric said, any provider should offer to you. Do I think that there's a risk going on here that the average person's doing it? Nah, don't. Healthcare workers, I'll put Eric on the spot one more time and ask, for healthcare workers, how many healthcare workers have gotten sick, do you think, associated with this event in San Diego? Because it's some, right?
Yeah, we've had 7 healthcare workers total, and one of those healthcare workers got it from a fellow healthcare worker in their same environment. So
yeah.
One of them was a secondary case. But those of those workers, all of them worked in clinical situations in which they were seeing patients that were either urgent or emergent cases that could have been these patients.
So you have kind of a spillover. But then the second question I'll ask you, and put you on the spot, is sanitation workers. You know, because for us, you know, I'm trying not to say canary in the coal mine, but it's a phrase that I keep thinking up of. For water systems, the people who I think are at the highest risk, really, if there is a risk within the water system, would be sanitation workers, the people who are working with water all the time. On a national level, we don't really have good proof that sanitation workers are at a higher risk for hepatitis A on a regular basis. How many sanitation workers got sick in
We have nobody who does it as that full-time job, but we have had, you know, for example, people who work in businesses in which among their duties, they're supposed to clean the bathroom for the public. So like a guy who works in a gas station who has to clean the bathroom himself or herself. We've had 2 individuals who had to do street cleaning after in known homeless area kinds of things, but nobody specifically who I would call a sanitation worker.
And more of a situation where the person was directly going to and potentially cleaning up, you know, after someone who really had hepatitis A was like physically there. Nobody who has been just generally exposed to water supply or general sanitation in general who has gotten sick. You know, if you think about it from the bigger picture, each year, I'll ask the question second, the bigger picture each year is hepatitis A is really gone from this country. It's not like, again, we don't have a whole lot of people springing out of the ground who just have hepatitis A. But because it is very common around the world, we certainly have a couple thousand people each year in this country who come back who have hepatitis A, and therefore the water system is exposed. And the fact that we really, other than wells, we really don't have, situations where you've had larger outbreaks, in communities associated with water systems or otherwise. I think generally, in my simplified mind, not understanding water systems terribly well at all, I don't know. But, to me, as an epidemiologist, that makes me feel kind of reassured, that this is not something that is across the issue, right? There was a question.
Quick question. When you were speaking earlier, you were talking about washing your hands 20 seconds, rubbing your hands. So I got the impression, you didn't mention water temperature, but I noticed you mentioned rubbing your hands and letting the water run over. Is each component in that rubbing your hand, the temperature of the water, is it really the friction we're talking about here?
It's the mechanical aspect, and it's having the soap. Okay, the soap and the mechanical aspect are really the key parts. The temperature has never been, the only thing that temperature does is maybe make it more acceptable to leave your hands under the water a longer period of time. That's the only reason. So that's why some people like warm water rather than cold, because they're more likely to keep your hands there. It's the mechanical aspect that's key.
Question in the back.
Yeah, so you had mentioned wells, and generally as wells, as a possible transmission route through surface contamination percolating and managing to make its way, or through sewer leak in its way. Typical municipal wells are constructed with a sanitary seal, approximately 50 feet of concrete, other things to seal the well. When you talk at wells as a transmission route, are you referring to wells that are mostly going to be private wells that don't have chlorination, so the municipal wells are not at risk?
No, the descriptions around the country have been like, a trailer park that has a well that is not treated as,
It's an important point to clarify, because people might have had to take away that, a municipal well might somehow have been at risk.
No, the gentleman. Go ahead.
Once contracted, what is the treatment? And if not treated, does it run its course like flu or?
That's a good question. And again, virtually all of these, Dr. McDonald can answer better than me, but he's getting tired, so I'm going to take this one to you. There is no specific treatment for it. The treatment is what we doctors call supportive. It means we give you IV fluids to keep you hydrated, and we watch, make sure your liver gets better. But there isn't like an antibiotic. There isn't a way to treat it. The treatment is your preventive by getting vaccinated to get to people getting sick. Historically, what we tell people in the literature is your chance of dying from hepatitis A is like 1 in 1,000. Okay. There is no chronic form of hepatitis A. Important to realize. B and C, you get chronic disease. Hepatitis A never happens. You get sick and you get over it, and then you get on with your life. What has been notable in San Diego is their mortality rate is about 3 or 4%. Is that about right? Yeah. So 1 in 25 people die. That's no kidding around. I mean, that is a serious illness. I think one part that's important to realize is a lot of the data involves, that 1 in 1,000 involves an awful lot of kids getting hepatitis. Kids who have perfectly healthy liver, they virtually never die of it. Adults, if you get hepatitis A, your chance of getting bad sick is much higher. And in this population, the other big issue, hepatitis B, hepatitis C. If you have an underlying liver problem, if your liver is not right to begin with, your chance of getting seriously ill and dying is also much higher as well. So, but again, like 70%, I think, of the people who've had hepatitis A in this outbreak have been hospitalized-ish somewhere.
That's correct.
This is not the common cold. This is a bad illness.
If you survive, is there immunity?
Yeah. It's like the vaccine. If you get it, you never get it.
Because I don't understand these things. So, incidents of exposure related to actually getting the infection. Everyone that touches the water faucet in one of those restrooms
is not going to get hepatitis A.
Correct.
Everyone who, what is that incidence of infection against exposure? Do you have any idea?
Yeah, I mean, there's two kinds of exposures that happen, at least in my mind. One is like that Costco berry outbreak that Eric had mentioned, like food source exposure. You know, everybody gets exposed to food that we find out is contaminated with hepatitis A. People usually in those situations, the risk is very, very low. You know, a very small percentage of the people who get exposed get hepatitis A, but it's always different for the different kind of foods. Probably, you know, one food's more likely than another food to make you sick. But in that situation, you know, it's always like 1% or less of those people who get exposed get sick. If you live in the same household with someone, then your chance is much higher. But it's hard to say that that's the one individual exposure because you're sharing the bathroom with the same person like multiple times. So I think the one individual exposure situation when you just come in contact with the community, hard to give you a number. A number doesn't exist, but the risk is very, very low. If you live in the same household with someone, sexual contact with someone, those are the sorts of exposures that make your risk way higher.
So, question?
So what I'm interested in, how long do you shed the virus?
Yeah, how long do you shed the virus? So there's two answers to that, okay, they're really important. The one is that what makes you sick in hepatitis A, okay? And without getting too doctory, many times the germ itself makes you sick. In other words, for flu, if flu gets into my lungs, the virus itself starts irritating, injuring, killing cells, my lungs get sick, I get pneumonia. Hepatitis A, the virus itself does nothing. You will be infected with hepatitis A, and you will be shedding the virus because the virus gets into your liver cells, gets into your chest, gets into your stool, you're shedding your stool, and you feel totally fine. When your body fights off the infection, your body's immune response to clear it up, that makes you sick. Okay? That's the thing that makes you. So what does that mean? That means that for 2 weeks, before you have any symptoms, it's in your body, you're shedding in your stool, you feel totally fine, but you're very infectious. Then for about a week after your symptoms start, that's your immune response, it's clearing it out, you're still infectious, probably less so, but so it's like 3 weeks, it's a while, and for the biggest time when you're most infectious, you have no symptoms at all. That's one of the problems with the spread.
So what about, I'm kind of concerned because many of the homeless people in San Diego also utilize candy. And so, I don't know about plastic bags. Are you able to gain any information on that? Because to me, if it lasts in the environment for a long period of time, you could be sitting out there, and then when the storm water comes down, that first flush or whatever happens, it could then go into coastal waters and expose people. Now, there was a recent study that just came out in 2016 that talked about the number of human-identified viruses in these streams, both in South Park, in Orange County, I think it also maybe one in Los Angeles, or and also San Diego County. So this is what I'm kind of concerned about. Is there a second story here that we aren't, it just hasn't rained this year, so this is what I'm thinking.
I have a quick answer to that. And you know, one of the principles we learned in medical school is the solution to pollution is pollution. Okay, and you may in fact have some of that entering, let's say, a water system like that, but it gets diluted out so quickly and so fast that it's not really an issue. The good news is there was a study done by San Diego State back in the early 90s of the Tijuana River, actually, in which they looked for specific viruses and they sort of matched that up with coliform counts. And they were able to show that when there wasn't rainwater, okay, when there wasn't rain, that you couldn't really detect hepatitis A in the Tijuana River. This is back when there was much higher numbers of cases of hepatitis A in Mexico, okay? So that's first in the context I want to give. And they also showed that when there was rainwater runoff, which allowed human feces to get into that stream basically, or into the river, they were able to detect some of RNA from the virus, but it correlated extremely well with the coliform counts. And so actually what the conclusion was, you could use your standard measures for contaminated water for coliform to give you an indication of both the burden of norovirus and hepatitis A virus, so that you could do things like close a beach if you have to because the coliform count is so high. That by itself would be protective also for hepatitis A. And now there are lots of studies out there that show that when there's water in in both San Diego and in Tijuana, when there's water runoff, that the markers for human feces go up, the proteins in the water and the coliform counts go up quickly. But we have mechanisms in place to deal with that. First of all, people aren't drinking the water. Second of all, there is water runoff into the beaches, and we have a policy and procedure in place to monitor those coliforms and then warn the public when those coliform counts go up. And I think it's fairly standard practice that, for up to 3 days after a major storm, we warn the public about this, and we continue to monitor. So the good news is there's a strong correlation between standard practice and the specific practice of looking for hepatitis A, which is a good argument that you don't have to spend a lot of time and effort looking for hepatitis A. Just use your standard practice.
Yeah, and I think that, I can answer better than Eric answered, but the other comment I have is, whenever we're talking, as this conversation has been talking about both in the homeless population, just in general, the relative risk of hepatitis A, hepatitis A is preventable. Hepatitis A, I can give a vaccine, and the vaccine is real graciously good. There are other germs out there. Shigella is one that comes to mind right away, that makes you sick, gives you diarrhea. It is a bacteria. It is passed person to person, and I've got no vaccines to keep that from being passed around. And we have had outbreaks in Orange County of Shigella in our homeless population. And when you talk about water sources or situations, like they have Ironman competitions, and so they all come into town and they're all supposed to go swimming in the water, and of course it rained and so it's dangerous, but everybody's flew in from out of town, so they don't care. They go swimming anyway, and they go in the water. In events like that, and just generally, you'll have outbreaks of things like Shigella. Those things have been identified. I don't want to be too certain of things, but the lack of evidence of outbreaks of hepatitis A in those situations, San Diego is far from the only time that hepatitis A is being introduced into water systems. It's probably happening pretty dang often, and I think our lack of seeing outbreaks like that is helpful. To me, it's an answer for sure.
I just want to thank both of you and clarify something that I don't think I've clarified. As part of the planning committee for WACO, this group, we meet once a month. We heard about the outbreak in the newspapers, et cetera, and the group takes some responsibility. I was concerned about the homeless population along the Santa Ana River, poor sanitation that's going on. Even at the courthouse, they're living around, and you read the newspapers, there it is. Sure. And what's the risk? And why does society allow this to go on? And could it contaminate our water supply when you consider the location, the recycling, replenishment, et cetera?
Well, for you all here, do I think the risk is really low? Yeah. Do I think it's really important that you all in this room are able to, give some answer to it that other than, probably the health department's on it? That sounds good. But I'm really happy that to the degree we can reassure you that, that we can't talk this through, because to me it's one of those things too where I'm like, well, I think it's probably a low risk, but this is all worth talking through. So I appreciate that very much. But the other thing I keep coming back to with the homeless population in Orange County is, when people talk about the risk, and we've had a lot of questions about should we put additional hand washing stations out, there's additional access to public restrooms. And of course there is a political level to this that transcends me. That's above me, and it's the larger question that Orange County is wrestling with if we provide services, then maybe we will have more homeless, and so maybe we don't like the idea of doing that, right? That is the pushback to any initiative that they can talk about, and we don't have time to get into that. But I mostly would point out, I know I'm getting the hook soon, but I would mostly point out that whenever we talk about any of these issues, hepatitis A is simply not the only risk in the homeless population there. Again, Shigella, we have MRSA outbreaks, norovirus, which is, causes the GI outbreaks in the cruise ships that everybody hears about, terribly common in the homeless population. There are a lot of important reasons why we have to do the right things in terms of safeguarding the public's health and safeguarding that community's health. Hepatitis A is one thing, but hepatitis A is going to come and go. We really have to think about what we think is appropriate long-term, from a lot of different sides, but certainly from the public health side of it. So I'll stop there. And again, I thank you all very much for the time and very much the chance to speak to you all. Request, Heather, is I think you have my contact information, and it would really make me feel better if my contact information could be just spread to the group. So if specific questions come up, either obviously hepatitis A or anything else, just make me feel good that you all know how to get a hold of us in the health department here in Orange County.
Thank you.
Please help me thank Dr. McDonald and Dr. Zahn for the presentation. Well, the meeting is over. Go home and drive safely. Wash your hands.